So, hi friends, I'm Dr. Anshul Bansal again joining you on this Unacademy platform. In today's YouTube live session, we'll study about Pott Spine. Okay, Pott Spine is a very important topic, especially for the INICT FMG. जो next month में INICT and दिसंबर में FMG है उसके लिए Pott Spine is very important topic. Okay, so we'll study about it. We'll study everything about it that is necessary, and you can also study this for the perspective of your professional university examination. Currently, I'm working as an orthopedic house surgeon in SMS Hospital Jaipur, and I've cracked the NEET PG examination last year, that is in 2020 only. Okay, so here we'll study in-depth orthopedics so that not only you can crack your NEET PG, INICT, FMG like competitive examinations, but also you can do well in your prof or university examinations. And also we'll have special focus on the clinical based scenarios, the conceptual based learning, the images, the x-rays, CT scans, MRI, etc., so that you can do well in your next type of examination pattern that is coming, and also in newer NEET PG and INICET pattern where there is more focus on the conceptual things of about the topic and your subject, and the images and the clinical scenarios, etc. Okay, so let's start today's session about Pott Spine. And before starting today's session, I will just briefly guide you about our various subscription plans that are available for the NEET PG on Unacademy platform. And the first one is your Plus subscription plan. The Plus subscribers will get access to all our live as well as recorded classes. They can compete in live tests and quizzes, and they will be given access to our entire QBank, all of which is found by the topmost faculty for the NEET PG in India. And also will allow the subscribers to log into multiple devices with the same account so that they can study on any device of their choice at any time. And also for the subscribers who will be subscribing for 12 months or more, we will be shortly providing them with the printed notes. You can subscribe for the subscription code for the subscription plan, and while subscribing you can use my code, that is Anshul B10, to get extra 10% off. The second one is the iconic subscription, and it is the best plan, and it is best subscription plan for the NEET PG, not only on the Unacademy platform but across any digital platform in India. And what makes this best is that apart from the things that I have told you earlier, in extra May you will get the prep ladder, and all of the prep ladder including all of its QBanks, the video lectures, rapid revision courses, the grand tests, quizzes, etc., everything you will get. And on Unacademy extra May you will get the well structured live batch wise classes, and we have formulated a batches and structured a course in such a way so as to build your basic concept about any subject or the topic first. And also we'll correlate the same topic that is covering in different subjects, like Pott Spine jo aaj apan padhenge, it is covered in orthopedics also. Some part of it is also touched in pathology and medicine and surgery also. So in every subject where there is Pott Spine, we'll revise the things that you have studied in your previous subject so that आपके concepts अच्छे से build up हो. And secondly, you can revise it very well. You can correlate the things and conceptualize your topic. Okay, and also after every test that you give, the iconic subscribers will get an individual test assessment sheet so that they can analyze themselves ki yes, this topic or this subject needs more revision from my sides, or what are the things that I am missing, ya fir what are the things that are asked more frequently about this topic or the subjects, ya question framing kaise hai. So all these are very important to plan your journey and your preparation to crack any competitive examination. And iconic subscription of the Unacademy provides all of the things that is necessary. And while subscribing you can use my code, that is Anshul B10, to get extra 10% off. Now special classes, I always emphasize on the special classes, so please do attend the special classes because they'll give you extra edge over your competitors. Okay, they are very important. And also it will give you live classroom like feeling, where you can interact with the educator in the live class. You can clear your doubts there and there only. You can participate in polls. You can watch it anywhere, anytime. What you have to do, you have to just download the mobile application of the Unacademy and log in using my code, that is Anshul B10, and both of which are absolutely free. So please do attend a special classes, and after every special class you will also be provided with a digital notes of that class. Okay, a QBank is very effective, and you should solve the QBank of sorry, you should solve the QBank of Unacademy. Why? Because not only it contains 25,000 plus questions, but the main thing is it will cover your every type of question that you could face in the examinations. Like it will cover your entire theory part, the recall or the recent high yield MCQs, the previous year's MCQs, the image based questions, the X-rays, CT scans, MRIs, the clinical based scenarios, instrument based questions, match the columns. Every type of question will be there in our QBank. So please do solve this QBank, and while subscribing for this QBank you can use this code, that is Anshul B10, to get extra 10% off. Now, to boost your medical preparation, we have launched a limited time period offer, that is from the 18th to till 21st of the October. Okay, so it was till yesterday only that you have missed. Okay, and it is now, this is very important, that for the INI-CT as well as for the FMG examination for this year, we are organizing two grand tests, both of which are in the October. That is INI-CT जो नवंबर में है, उसका grand test is on the 14th of the October. This is the second grand test for this examination. It is absolutely free between 2 to 5 p.m. and on 31st of October for FMG, which is in December, we have a grand test on this pattern between 10 to 1 p.m. Okay, and please do give this grand test. It is also free, and think it like this way, that 3 hours of solving the paper and 3 hours of reading the explanations and analysis of your paper. In 6 hours you can revise the most important 200 topics for the INI-CT and the 300 topics for the FMG. So it will be very high yielding as well as important for your preparation. So please do give this grand test. Okay, and on 23rd of October, focusing on the NEET PG 2022, we are organizing another grand test between 2 to 4 p.m. on obs, gynae and radiology. Okay, so please do give this grand test also. And we have launched a new feature called raise a hand feature to make our live classes more interactive and to increase the participation of our learners and to increase the two-way communication, because all of you are now preparing by the digital platform due to COVID, and to make this digital platform more interactive and to give you more classroom like feel, we have started this new feature called raise a hand feature, where you can just tap on a button and digitally raise your hand, so that the educator will come to know about your query and you can solve your doubts and query there and there only. Okay, and focusing on the NEET PG 2022, we have started a batch from 20th October for them, and a very important clinical case discussion and instruments batch is started from the 20th October. And it is very important because the things that you read theoretically, sometimes it is very difficult to understand them, conceptualize them, and also it may get boring. But in this batch you will see all the things that you read in the theory in patient. Okay, so आप patient में देखेंगे कि how it looks like clinically, so you will first of all never forget them. You can understand the concepts very well, and also it will generate your interest towards your study, towards your topic and the subject, which is very important. Okay, and also you can do well in your next type of examination pattern and your practical part of the examination. So you can subscribe for any of these plans, and while subscribing you can use my code, that is Anshul B10, to get extra 10% off. Okay, so these are the subscription plans of a plus as well as iconic subscription, and here you can see that the cost per month decreases significantly if you increase the duration of your course. So economically it will be better for you to take the subscription for course with longer duration, and also academically also it will be beneficial to you. Why? Because from the word go, you desire to have a single source of information, so that you don't have to hop around for reading different topics or subjects from different sources, because it will make your revision and your study very difficult and cumbersome, and also it will be very difficult for you to remember the things and conceptualize the things. Okay, so Unacademy is the best and it provides everything. So I would suggest to go for the subscription plan with longer duration, and you can use my code while subscribing for any of the subscription plans, that is Anshul B10, to get extra 10% off. Okay, now let's start today's lecture about the Pott Spine. Okay, Pott Spine, as we all know, is also called as the Pott's Paraplegia. Okay, it is also called as the Pott's Paraplegia. It is nothing but tuberculosis of the vertebral column or tuberculosis of the spine with neurological involvement. Okay, and it is important to know that the न्यूरोलॉजिकल डेफिसिट के चांसेस जो होते हैं, इट इज 1 out of every 5 पेशेंट्स ऑफ पॉट स्पाइन. ओके, एंड ये ध्यान रखना है हमेशा कि पीआईवीडी या फिर वर्टिब्रल बॉडी या वर्टिब्रा की जो फ्रैक्चर्स इंजरीज होती है, दे ऑल आर रिलेटेड टू द पोस्टीरियर पार्ट ऑफ द स्पाइनल कॉलम और द वर्टिब्रल कॉलम, वेयर पॉट स्पाइन में हमेशा anterior column, anterior part will be involved first. Okay, so most commonly जो होता है, it is of the anterior side of the spinal column, first thing, and secondly most commonly it is in the dorsal spine or the thoracic spine. Okay, it is most commonly in the dorsal spine or the thoracic spine, whereas the PIVD etc., they are more common in the dorsal-lumbar spine, and उसमें भी the lower lumbar spine में they are the most common. And why Pott's paraplegia, Pott spine is more common in the thoracic column? Because the vertebral canal or the spinal canal is the narrowest in this part, so a small compression will also lead to the neurological deficits. Okay, so pathology, why there will be symptoms? Because obviously there will be a lesion due to tuberculosis of the spine, and this lesion will lead to the compression of the spinal cord or the nerve root. So the most common cause of the compression is your frank pus, that is the extradural pus, and the granulation tissue which is formed. Other causes can be the inflammatory edema due to the cytokine storm etc. And sequestra. See, what is sequestrum? Sequestrum is the dead or the devascularized bone or the dead or extruded disc materials, and it can compress the neurological structures in the canal. And also very very important is your internal gibbous. Okay, internal gibbous kahin pe bhi aa jaye, then you should have in mind the Pott spine. It is a characteristic feature of Pott spine. Okay, so internal gibbous में क्या होता है? Due to disease spine, due to tuberculosis, there is angulation and there is a formation of bony ridge like this, again where on the anterior wall. Okay, very important. I have told you in the beginning of the lecture that everything here will be starting from the anterior wall. Okay, so anterior wall पे lesion की वजह से वहाँ पे there will be a bony ridge or an angulation which is called as the internal gibbous. Okay, so here you can see this is an angulation, and see, this is your anterior part and this is your posterior part. Okay, this is your anterior, this is your posterior part. Here you will have the vertebral body, this is the vertebral disc, here this is your spinal canal, and here these are your spinous processes. Okay, now here you can see the lesion here. okay, which is devascularizing and eroding the vertebral bodies and leading to the compression of the vertebral canal. Okay, so this is your anterior, this is your posterior, and here you can see ki, this, 1 minute, yes, here is your spinal cord, this is your vertebral body, this is your spinous process, and here you can see this is an internal gibbous lesion which is leading to this type of bony ridge here. Okay, this is leading to this type of bony ridge here. You can see, very easily appreciate here this. Okay, so this is your bony ridge here. Okay, starting from the anterior wall here, this is the characteristic feature of the Pott spine. Okay, now the in pathoanatomy there can be two types of infection. First is your early infection and second is your late infection. Okay, so early infection may you can differentiate it from the pyogenic osteomyelitis of the vertebral column or the pyogenic infection of the vertebral column. How? First of all, the tuberculosis का जो होगा, the onset will be insidious as compared to the pyogenic infection, and in tuberculosis disc will not be involved in case of early infection. It will be involved only in case of later cases where there will be complete destruction. Okay, so first of all there will be no involvement of the disc space in the early stage, whereas in pyogenic early stage में ही disc infection हो जाएगा, and there will be paraspinal abscess, but obviously these abscesses या pus they will be more common in case of pyogenic infections. Okay, so pyogenic infection में these paraspinal abscesses वगैरह will be seen in case of almost every case, but in case of every case that too in the early stage only. But in case of tuberculosis of the spine, these paraspinal abscesses are seen only in cases of only in 50% cases. And remember, again they are most commonly in the anterior region. Okay, they are most commonly where? They are most commonly in the anterior region. So इस slide से you have three takeaways important. First is your differentiation between the pyogenic osteomyelitis of the vertebral column में three important things. First of all, in tuberculosis onset will be insidious, disc will not be involved in the early phase, and on paraspinal abscesses के chance will be only in the 50% cases in case of the tuberculosis of the spine. Now remember that tuberculosis of the spine first of all affects the vertebral body, and that too its metaphysis वाला area. Okay, vertebral body and that too its metaphysis वाला area. And again as I've told you, anterior सबसे पहले involved होगा, so the anterior longitudinal ligament is involved first, then it will lead to the multi-level involvement. Okay, so remember this is very important again. Now in case of chronic infections or the late stages, what you will see, there will be destruction of the spinal cord, so there will be deformity of the vertebral column. So deformity will be kyphotic type of deformity, very common in PIVD or prolapse or herniation etc. In chronic cases वहां पे भी क्या होता है, kyphotic deformity ही most common होती है. And also in case of pyogenic infection of the vertebral column in healed or later stages also kyphotic deformity is the most common. Okay, so ये याद रख लो, kyphosis is the most common. Okay, and if the involvement is of the vertebral body and the posterior part, okay, most commonly anterior part होता है और posterior part involves in the late stages. We have already discussed it many times. So late stages है, तो अगर posterior involvement का involvement हो रहा है, it means that the disease has progressed to a very advanced stage or the late stage, so the progression of kyphosis will be at a higher rate. Okay, so it is more severe in and kyphosis is more severe in case of pyogenic infection as compared to the टीबी का इन्फेक्शन, ओके, सॉरी, more common in case of granulomatous infections, that is the TB. So TB insidious in onset होगा, disc space not be involved in early cases, paraspinal abscesses के chances will be less, and the kyphosis will be less severe and slower in progression. अब ये पॉट स्पाइन है, इसमें जो डिफॉर्मिटी होती है या फिर जो लेट स्टेजेस में मैनिफेस्टेशंस होते हैं, उसके लिए यू हैव अ क्लासिफिकेशन विच इज बेस्ड ऑन द प्रोग्रेशन ऑफ द डिजीज, which is called as the Rajasekaran classification. You just need to remember the name. इसके अलावा you don't need to go in depth. Just remember Rajasekaran classification is related to the deformity of the following Pott spine. Now another cause is your infection of the spinal cord. Okay, so cytokine storm होगा और necrosis होगा and edema होगा. So इन सब की वजह से what happens, there can be blockage of the anterior spinal artery. Remember which artery? Anterior. यहाँ पे भी क्या आ गया? Anterior आ गया. So anterior spinal artery will be blocked due to the inflammatory reaction, and it can lead to the paralysis or the compression. But again, remember, this is very unusual and this is rare. Okay, this is not one of the commonest thing, or it is not one of the commonest cause of neurological deficit in this disease. It is very rare. I've just included this slide to just share one important thing कि अगर artery से related question आ जाए, so again the answer in case of Pott spine will be your anterior spinal artery. Okay, another thing that you should remember is the extradural granuloma. Obviously it will be formed, okay, and it can also damage the osseous and the neurological structures, but it is again rare. So why I have included it? I have included it because if there is extradural granuloma ka formation, the symptoms will be like the spinal tumor syndrome. Okay, spinal tumor syndrome. So what is spinal tumor syndrome? Spinal tumor syndrome में क्या होगा? You will have this neoplasia like symptoms, like there will be a lump or the swelling on examination, okay, and also there will be neurological deficits, etc. So the symptoms will be like spinal tumor. So spinal tumor granuloma अगर question में आता है, then you should think about the extradural granuloma. Remember this. Okay, so two takeaways from this slide: first, anterior spinal artery, and second, extradural granuloma will present like the spinal tumor syndrome. That's it. Okay, now the symptoms as we have discussed, as compared to the pyogenic one, the symptoms will be insidious in onset. Okay, the symptoms will be insidious in onset as compared to the pyogenic one, and there will be typical symptoms in case of tuberculosis like malaise, night sweat, weight loss, anorexia, that is decrease in appetite. Obviously there will be back pain. Okay, and in the later stages when there is bony destruction, there can be the deformity also. Okay, it can lead to the deformity. And on physical examination we have already discussed that there will be kyphotic deformity, and in neurological examination you can have the neurological deficits. Okay, and the most common cause of neurological deficits, especially in case of early stage, is your abscess. Okay, abscess or the pus, the granulation tissue, the debris, caseous material, etc. Or if there is destruction of the vertebral column, there can be subluxation or dislocation, and there can be kyphosis, deformity leading to the paraplegia. Now what is paraplegia? What is hemiplegia? Remember, both upper and the lower limb of the same side, like lower limb and the upper limb, both of the left side or the right side, it will be hemiplegia, whereas upper limb right plus left, it will be paraplegia, or lower limb right plus left, yani both lower limb, then also it will be paraplegia. And if there is involvement of all four limbs, then it will be called as the quadriplegia. Okay, remember, so remember like this ki hemi means half or two, so half of the body is involved, that is same side के both upper limb and the lower limb, that will be hemiplegia. And both the upper limb or both the lower limb, that will be paraplegia. And all four limbs will be the quadriplegia. Okay, so अगर brain में injury होती है, then the most common thing that you come across is your hemiplegia, like in case of CVA infarct or okay, CVA infarct or the hemorrhage, etc. There you have the hemiplegia. Whereas in case of the diseases of the vertebral column, like in case of disc protrusion, okay, like in case of vertebral fracture, or even in case of this Pott's paraplegia, नाम में ही paraplegia है, okay, Pott spine, you will have the paraplegia. Okay, remember. And in case of cervical spine also, either you have the paraplegia or the quadriplegia. So remember, hemiplegia brain, paraplegia spinal cord, in general, talking in general terms, not in the specific term. Okay, now in case of advanced stage, there will be healing, so it can lead to the ossification of the ligamentum flavum, okay, which can lead to the stenosis. What is stenosis? Stenosis means space कम हो जाना. Okay, so there will be obliteration or stenosis and the severe kyphosis, and all this will lead to the neurological deficit or the neurological symptoms. Okay, now we'll come to the types of Pott spine that we have already discussed. First is the early onset paraplegia, where the paraplegia occurs in the active state, and इसमें याद रखना है before completion of the 2 years, that is within 2 years of the onset of the disease. Okay, and अगर 2 साल के बाद हो रहा है, then it is called as the late onset paraplegia. Okay, and if it is occurring after 2 years, then it is called as the late onset paraplegia. Okay, so clinical features we have discussed. The systemic features like evening rise of temperature, night sweats, malaise, weight loss, anorexia, back pain, and neurological complications. Okay, now neurological complications में different grades हैं that we will discuss. Okay, now you need to remember that it will start as a spastic paralysis. Yani spastic paralysis means just understand like this ki there will be increased tone of the muscles, and later on it will convert into a spastic से किसमें convert होगा into a flaccid paralysis, where there will be no tone. Okay, so starting में it will be spastic, and initially जो first early sign होता है of any neurological complication due to the Pott spine, it is your checking of the clonus, the ankle or the patellar clonus. Okay, you need to do two things. First of all, you need to check the clonus, the ankle and the patellar clonus, and secondly you have to check the Babinski sign. Okay, and secondly you need to check the Babinski sign. So दो चीजें in early stages जो सबसे पहले involve होती है, the clonus, ankle and the patellar clonus, and second is your Babinski sign. Babinski sign is very important for your any prof university examinations as well as for your any competitive examination. So you need to learn about the Babinski sign very importantly. So it is a polysynaptic reflex, which is a cutaneous type of reflex. Okay, polysynaptic cutaneous type of reflex. And what you do in this reflex, see, if this is your foot, okay, and if you have a pointed thing like this, then in normal individuals there will be what, in normal individuals there will be this flexion. Okay, so it is Babinski sign which is normal. but if Babinski is positive, कभी भी ये नहीं बोलते हैं Babinski negative. Okay, and if the Babinski is positive, like you can see, there will be extensor response of the plantar region or the foot sorry, or the foot region. Okay, so सबसे पहले various stages जो होती है, so we'll study in the same order. So for first stage there will be only muscle weakness. Okay, muscle weakness, so there will be incoordination, and starting mein there will be spasticity as we have discussed. Okay, there will be incoordination, and remember, first sensation to be affected in case of Pott spine is your pressure one. Okay, remember spasticity se start hoga, and first sensation to be involved is your pressure. Then there will be paraplegia in extension, then paraplegia in flexion, and then there will be complete flaccid paralysis. Okay, so muscle weakness, paraplegia in extension, paraplegia in flexion, and complete flaccid paralysis. अगर इन दोनों में confusion हो, so remember like this कि alphabetical order में भी C, D, E, F. Okay, so E comes first, then F comes. So first there will be paraplegia in extension. Okay, so paraplegia in extension में क्या होगा? The limb will be, especially the lower limb will be in the extension position at the hip joint and the knee joint, and the tone of the muscles will be increased because this will be a spastic one, as we have discussed, and it is due to absence of normal corticospinal inhibition. And in paraplegia in flexion में क्या होगा? The corticospinal के साथ में there will be deficit in function of the paraspinal tract also, leading to the paraplegia in flexion and complete flaccid paralysis में all transmission from the cord will be stopped. Okay, now different gradings जो है Pott spine की, it is divided into 4 grades. We have discussed it already, but upgrading के form में if we'll discuss, it is on the basis of degree of motor involvement. Remember किसके basis पे? It is on the degree of motor involvement, because remember एक और चीज कि sensory involvement in Pott spine is late. Okay, एक चीज हमेशा याद रखना, sensory involvement in Pott spine is late. Okay, now grade 1 में the patient will not be aware about the neurological deficit, but again if you check the Babinski or the clonus, they will be positive. Clonus will be exaggerated and Babinski will be positive. There will be extensor plantar response. Okay, so grade 1 mein you need to remember patient will be unaware, Babinski and clonus, no neurological deficits or the paraplegia or sensory involvement will be there. In grade 2, patient will come to know about the neurological deficit and there will be incoordination or the clumsiness, but the patient can still walk with or without support. Okay, so there will be spasticity as we have discussed. Now in grade 3, इससे next level होगा. Next level में the patient will not be able to walk, and the paraplegia that will occur, it will be obviously in which it will be paraplegia in extension with spasticity, and there will be no or minimal sensory loss. Okay, there will be no or minimal sensory loss. In grade 4, there will be complete flaccid paralysis in paraplegia in flexion with severe muscle spasm, then complete flaccid paralysis. So flexion में होगा, unable to walk, and इसका जो main होता है that is your sensory deficit will be present, and sensory deficit will be present, so there will be loss of sensations with the sphincter disturbances like bowel and bladder will habits, or there will be bowel and bladder incontinence. Okay, so there will be bowel and bladder incontinence. So grade 1 में patient unaware, Babinski clonus positive, no incoordination, no paraplegia. In grade 2, the patient can walk, but there will be incoordination or clumsiness. In grade 3, there will be frank or बिल्कुल अच्छे से पैराप्लेजिया इन एक्सटेंशन विथ नो सेंसरी लॉस. In grade 4 there will be paraplegia in flexion, then complete flaccid paralysis, and there will be sensory loss and the sphincters involvement. Okay, so paraplegia in extension we have already discussed ki it will be extensor attitude of the lower limb, whereas in paraplegia flexion lower limb will be in flexion attitude. Only pyramidal tracts in extension, whereas in extension cortico spinal, that is pyramidal के साथ extra pyramidal tracts भी involved होंगे. And we have discussed कि evolution ये पहले होगा and it will be a late thing that will be occurring. So जो अपन ने grade देखी, grade 1 2 and 3 4, इसी को ही we have named it like negligible, mild, moderate and severe, same चीज. And this is called as the Tully and Kumar's grading of the paraplegia. So you just need to remember the name, that's it. Like Rajsekran classification was deformity progression of the Pott spine, whereas the neurological deficit progression of the Pott spine के लिए there is Tully and Kumar's classification or grading. Just remember the name. Okay, so we have discussed already कि early onset paraplegia है, so the most common cause will be your abscess. Okay, the other causes can be the granulation tissue or the caseous material or the circumscribed focus, any posterior spinal disease or the thrombus like the anterior spinal artery, etc. Whereas late spine onset paraplegia have, that is after 2 years, then the most common cause is your gibbous. Okay, most common cause is your gibbous, that is prominent anterior wall in case of severe kyphosis. There can be other causes like recurrence of the disease or the healing के बाद there can be fibrous septa. Okay, now radiograph में क्या दिखेगा, this is again very important. So the next important thing is your radiograph features. So in early infection, again anterior vertebral body का involvement होगा, there will be lesion and the erosive kind of lesion of the anterior vertebral body. And we have already discussed कि there will not be involvement of the disc space, unlike the pyogenic infection, whereas in the late infection the disc space will be destructed. There will be lucency and compression of the vertebral bodies and kyphosis. Okay, so in CBC there will TLC count will be increased and the lymphocytes will be increased more, hemoglobin will be less, ESR will be elevated, and there is one specific test called as the PPD, purified protein derivative of the tuberculin PPD, and it will be positive in 80% of the cases. Okay, now इन्वेस्टिगेशन ऑफ चॉइस इज योर एमआरआई. यहाँ पे आपको दो चीजों में हमेशा कंफ्यूजन होगा, दैट इज योर सीटी गाइडेड बायोप्सी एंड योर एमआरआई. ओके, सो बोथ आर गुड. जो डिफरेंस है इट इज द इन्वेजिव बट कंफर्मेटरी and it is not invasive. And one more problem that is there with the CT guided biopsy is that sometimes what happens ki lesion, suppose this is your vertebral body and lesion is here, but sometimes due to human error or the machine error, anything you call, sometimes यहाँ से if you take the sample for the biopsy, sometimes क्या होता है, the sample may not be appropriate, or the position or the site of the sample collection in case of CT guided biopsy may not be appropriate, so there can be false negative. ओके, सो अगर कोई भी आपसे पूछे विच इज द इन्वेस्टिगेशन ऑफ चॉइस, जस्ट अगर ऐसा क्वेश्चन आता है, देन द इन्वेस्टिगेशन ऑफ चॉइस even in case of a Pott spine will be your MRI. But if there is a history of a Pott spine given, and then the question is like what is the next step of management, or what will you do next, that means then you will have to go for the CT guided biopsy for the confirmation. We do not start the ATT, or we do not call the case of Pott Spine a confirmed case of Pott Spine without the CT guided MRI, sorry, CT guided biopsy. We first do the MRI. MRI में we see the films and the lesion, and we can diagnose कि yes, it is Pott Spine, but we cannot confirm it. Confirm के लिए, confirmation के लिए, you always have to go for the CT guided biopsy. So investigation of choice will be MRI. Confirmatory investigation of choice या investigation for the confirmation ऐसा question आ जाए, then that will be the CT guided biopsy. And if what will be the next step of management, then answer will be your CT guided biopsy. Okay, treatment के 3 aims होते हैं. First of all, जो लीजन है यानी ट्यूबरकुलोसिस इटसेल्फ है उसको ठीक करना. सेकेंड इज जो न्यूरोलॉजिकल डेफिसिट्स है उसको ठीक करना या फिर उसका प्रोग्नोसिस. एंड थर्ड इज टू गो फॉर द रिहैबिलिटेशन मेजर्स और द physiotherapy, so that due to neurological impairment etc there is no development of the atrophy or contractures etc. So first of all, rehabilitative measures. Secondly, the healing of the vertebral lesion. And third, the recovery of the affected neurological tissue by decompression. Okay, so अगर ये ठीक हो जाएगा then this can be achieved automatically. So the treatment of choice, जो first treatment आपको हमेशा करना ही करना है, is to start the oral ATT. Okay, so whether the treatment is indication is operative or non-operative, you always start with the non-operative one and you go for the anti-tubercular treatment or the drugs, that is the ATT, with spinal arthrosis. Now what is spinal arthrosis? Spinal arthrosis are braces, like you have the TLSO brace, thoracolumbar spine orthosis, or the LSO brace, that is the lumbo sacral orthosis. Okay, so you will keep the patient in brace to support the vertebral column so that there is no any pathological fracture, disc herniation etc. Okay, so non-operative treatment के लिए only non-operative treatment if there is no neurological deficits, and the drugs are the HRZD, as you all know. H for the isoniazide, R for the rifampicin, Z for the ethambutol, E for the ethambutol, and Z for the pyrazinamide, and S for the streptomycin. Okay, so just open your pharmacology books, just give 5 to 10 minutes and read the entire ATT regime. Okay, the multi-drug resistant etc, they are very important with their complications or the side effects of each drug. It will just take you 10 to 15 minutes. Just give a fast reading. So this is the best way to revise. मैं हमेशा ऐसे ही पढ़ाई करता था. यहाँ पे ATT आ गया, and now if I'll recall ना, I will not remember most of the things and I will be very anxious and literally I would be afraid कि यार ये मैंने सिर्फ 1 महीने पहले पढ़ा था, now I am blank. But don't worry, it happens with everyone. Okay, we are not, anybody is not geniuses. Okay, you need to revise the things to learn them. Okay, so रिवीजन का सबसे अच्छा तरीका यही है कि अभी ATT आया है, just open your pharmacology books, 10 to 15 minutes, just give a thorough reading, and you will revise it and you will not forget it. Okay, so please do this. Now conservative treatment, the mainstay is the anti-tubercular chemotherapy. Okay, the 4 drugs hote hain. Now other than this, what you have to do in case of non-operative management, you have to stabilize the spine, you have to do the prognosis so that there is no pathological fracture or disc herniation by the absolute rest, or keeping the cervical spine if it is affected in traction, or dorsolumbar spine के लिए you have the brace. And if there is paralysis, you have to take care of it. There should be physiotherapy. Okay, there should be passive stretching etc. Okay, and if it improves paraplegia, conservative management. Patient can be allowed to sit in the bed, but there are 2 things that you should do. First of all, brace. should be there, and secondly the anti-tubercular drug should be started. Okay, and even after the slowing of the symptoms, you continue the bracing after the completion of the ATT के बाद भी at least for the 6 to 12 months. Okay, so operative treatment के indications जो होते हैं, they are first of all if there is paraplegia even after the कंजर्वेटिव ट्रीटमेंट और ड्यूरिंग द कंजर्वेटिव ट्रीटमेंट, पहले नहीं था लेकिन कंजर्वेटिव ट्रीटमेंट स्टार्ट करने के बाद देयर इज पैराप्लेजिया, और इफ इट इज गेटिंग वर्स or not improving in case of conservative treatment, or if there is severe paraplegia with rapid onset, because generally it is not with rapid onset in tuberculosis. So rapid onset severe paraplegia, or you can call it in early stage only, if there is paraplegia, then you should go for the operative treatment. So the operative treatment here, what you have to do, you have to go for the decompression of the, क्या करोगे, जो न्यूरल ट्यूब्स या फिर nerve roots or the spinal cord that is compressed, you have to decompress it, or you have to do the corpectomy. And obviously involvement हमेशा से I am telling you Pott spine में anterior, so there will be anterior decompression with or without stabilization or the posterior column shortening. ये सब no need to remember, just remember there will be decompression, and that to the anterior decompression. So indications we have already discussed. Okay, now kyphosis is a late feature, but if it is there, then whether you have to do the operative correction or the surgical correction of the kyphotic deformity or not. Okay, so इसके जो indications है, so the indications for surgery in case of kyphotic deformity are, first of all, if it is more than 60%, sorry 60 degrees in adult, or in child में if it is progressive, or if there are involvement of 3 or more vertebral bodies, or the vertebral bodies of the thoracic spine अगर सिर्फ 1.5 से ज़्यादा है, तो भी you can go for the kyphotic deformity का correction. Now surgical treatment is nowadays advised and preferred over the non-surgical treatment in case of Pott spine. Pott spine में nowadays the rule of law is that if there is no neurological deficit or no neurological symptoms, then you go for the only non-operative with bracing, physiotherapy, etc. But if there is mild neurological deficit at any stage, then you simply go for the surgical correction. Okay, so advantages is that obviously you'll halt the disease pehle, so there will be less kyphosis, earlier healing, there will be no destruction of the bones and the spinal column, so there will be decreased formation of the sinus, and especially in case of neurological deficit, this early debridement and decompression will lead to the more fast and improved neurological recovery. Okay, so the operative procedures जो होते हैं, it first that we'll read about is the costotransversectomy. So नाम से पता चल रहा है, costo means rib, so there will be removal of a section of rib of around 2 inches with transverse process. So it is generally indicated in child with paraplegia, and you can see a tense abscess in the x-ray. Okay, so children may you go for the costotransversectomy. And if you are asked what is the operative surgery or the choice in case of Pott spine, then it is your anterolateral decompression. Okay, it is your anterolateral decompression which is the most commonly performed one. And इसमें what are the structures that you will remove? You will remove the ribs, the 2-inch part of the ribs, the transverse process, उसके पीछे there is pedicle, and then a small part of the body of the vertebra. You will not remove the lamina. Okay, see, in case of PIVD or disc extrusion or herniation or in case of fracture of the vertebra, अगर उनमें neurological deficit है, then you go for the decompression only. Okay, यहाँ पे भी you go for the decompression, but that we have already discussed कि यहाँ पे posterior will be affected, so the decompression will be called as the laminectomy. You will remove the lamina. Lamina is the part between the spinous process and the transverse process. Okay, so you will do the laminectomy, that is at the posterior side. But laminectomy करने से क्या होगा, there will be your vertebral column will be destabilized. Okay, so to make that more stable, what you will do, you will just put a fixation of the spinal of the vertebral column by the pedicle screws. But here you will not do the laminectomy. Okay, lamina is not removed. Here you will do the anterior lateral decompression, जहाँ पे आपसे spine transverse process तक ही remove करते हैं. Okay, and now the more radical and पुराने जमाने की चीज is your debridement and arthrodesis called as the Hong Kong operation. So you just need to remember the name, that is Hong Kong operation of the spine is done in case of Pott spine with paraplegia. Okay, and here what is done, radical है, so you will have a transthoracic or the transperitoneal approach, and you will completely remove the diseased or dead vertebra and replace it by the rib grafts. Okay, now laminectomy, it is indicated only in case of the spinal tumor syndrome, that is the extradural granuloma, and if there is any posterior spinal disease. Okay, posterior spinal disease. Okay, and for cervical spine you go for the anterior decompression. Okay, now prognosis. प्रोग्नोस्टिक फ्रैक्टल वेरी इंपॉर्टेंट, इस पे क्वेश्चन बहुत कॉमनली आता है. ओके, सो इन केस ऑफ which part of the vertebral column is commonly affected by Pott's disease? Okay, so first of all, the involvement will be of the plus Kelvin, the involvement will be of the vertebral body, that to the metaphysis part and that to the anterior part. Okay, so age, remember children का prognosis is good as compared to the adults. Acute onset has a better prognosis. Acute onset paraplegia has a better prognosis. Remember this. Duration, long standing paraplegia have a poor prognosis. So acute onset का prognosis is good, children का prognosis is good, long standing का prognosis is bad. Motor paralysis का good prognosis, because we have seen कि sensory is involved in the late part only, यानी sensory paralysis है, यानी the disease have progressed or advanced, that is a bad prognosis. So motor paralysis is good. Sphincter involvement is a bad prognosis, and progression, sudden progression of the paraplegia is a bad prognosis. Okay, so now we'll have some questions about this topic, and then we'll sum up the topic. So tuberculosis of spine, best diagnostic modality here. ओके, सो यहाँ पे MRI एंड CT गाइडेड बायोप्सी दोनों ही दे रखी है. सो बेस्ट डायग्नोस्टिक मोडालिटी, both can be the answer. The MRI CT biopsy both can be the answer, but if I have to go for single best answer for this question, okay, then for the diagnostic modality अगर है सिर्फ investigation होता, then we would have thought, but diagnostic modality के लिए I will go with the CT guided biopsy. Okay, now tuberculosis bone is due to, okay, I'll give you 15 seconds and you can type your answer in the live chat box. Okay, so the answer for this question will be your first most common route of spread is your hematogenous, and that to the paucibacillary. So the answer will be paucibacillary and hematogenous. Earliest feature of spinal tuberculosis is and here are your 15 seconds. Okay, so the answer here will be your A. The answer will be your A, gibbous. Now you will say कि sir gibbous तो आपने बोलता late stages में होता है, but remember muscle spasm, pain, श्वास abscess, these no, all are not the features of the spinal tuberculosis. Okay, but gibbous is a characteristic feature of spinal tuberculosis. Okay, now the most common sequelae of tuberculosis spondylitis in an adolescent is very important question. Here are your 15 seconds. Okay, so very important. Remember कि there is ankylosis in case of tuberculosis, especially when it is healed. Ankylosis is formation of disruption of the joint or fusion of the joints. Okay, so it starts with the fibrous ankylosis, but the most common sequelae, especially in the adolescent, is K or bony ankylosis. Remember this, bony ankylosis होता है TB spine में. In ankylosing spondylitis also there is bony ankylosis. Okay, and in any other way, like if there is, okay, remember in case of tuberculosis of hip or tuberculosis of knee, there will be fibrous ankylosis, but in case of tuberculosis of the spine, there will be bony ankylosis. Okay, now tuberculosis of the spine commonly affects all of the following parts of the vertebra except. Very good question. I'll give you 15 seconds for this. Here are your 15 seconds. Okay, so remember हम हमेशा I'm telling you from the starting of the session only anterior. Start anterior से होता है, most common is your anterior. Okay, so the posterior most part is your spinous process, so it will be the most it will be the least commonly affected part, so the answer here will be your spinous process. Okay, now next question. In tuberculosis of spine, which one of the following is not a cause of paraplegia? Not a cause of paraplegia. Here are your 15 seconds. Okay, so stretching of the spinal cord in gibbous deformity, yes हो सकता है. Spinal artery का compression, not compression, infarction of the anterior spinal artery हो सकता है. So yes, this will be a question mark. Compression by granulation tissue, yes. Edema of the spinal cord, yes. So the answer will be spinal cord compression, spinal artery compression. अगर यहाँ पे compression के अलावा spinal artery blockage और infarction होता, then also the answer would be B, because I have told you in my session that it is a rare thing. Okay, so the answer will be spinal artery compression. Now next question, the first sign of TB is, here are your 15 seconds. Okay, so destruction of the lamina and spinous process का fusion first sign तो बिल्कुल ही नहीं होगा, because these two are the posterior structures. Rare fraction of the vertebral body and narrowing of the vertebral space, intervertebral space. Okay, so rare fraction of the vertebral body is also a late feature seen in the CT and the X-rays. So the answer of this question will be the narrowing of the intervertebral space. Okay, so that was all about today's session. Counseling schedule has been declared, so read it, go through that procedure very carefully. I'll have a special session on this. Okay, so thanks for watching. If you like my video, please like, share and subscribe, and click on the bell icon. You can subscribe for any of the subscription plans on the Unacademy using my code, that is Anshul B10. Okay, so please do subscribe and you will get extra 10% off also.